Tonight, cancer centers across the nation dealing with a shortage of a chemotherapy medicine. And here in Augusta, the Georgia Cancer Center says they've been able to meet patient needs. They're just not sure how much longer.
Our Taylor Martin live in our newsroom tonight. Taylor, you spoke with the oncology pharmacy at the Georgia Cancer Center on what this can mean for our local cancer patients. What did they have to say?
Well, shortages of chemotherapy medicines are hitting cancer centers across the nation. And here at home at the Georgia Cancer Center, they say it's one of the most significant issues they've had to face. Cervical cancer, leukemia, breast cancer, and many more are all treated by cisplatin, carboplatin, or methotrexate. The Georgia Cancer Center says they're working harder than ever to find those three chemo drugs.
We've been very aggressive with our inventory, checking it at least 3 times weekly against who's scheduled.
Like many other survivors, it was cisplatin that helped Catherine Saunders' husband beat testicular cancer.
I think it is entirely possible if he had not had access to that drug several years ago, he may not be here.
With shortages beginning in February of this year, the Georgia Cancer Center has been able to stay afloat, taking care of patients' needs. But if there isn't a solution soon, they're not sure what the future holds.
I just truly don't know what we would do with the fact that the shortage doesn't seem to have a resolution date at this time. We're going to have to get creative, and that's never something you want to tell a patient.
Now the pressure is on lawmakers to help cancer centers across the country keep providing care and saving lives.
It's a really heartbreaking conversation, and I feel very lucky that we've been able to not have to go down that route for our patients here, but we certainly don't have endless supply. We may be facing that conversation soon.
And one thing the Georgia Cancer Center tells me about these medications is there's no alternative. So there's no better time for a solution than now.
Those drug makers really have to catch up with this demand because it's not just a problem here.
And it's a low-cost drug to make, so there's a lot of frustration all the way around about this issue. Taylor, thanks.